Hello, I'm Mike, and this is the Keep It Resilient Show. Today I have a special guest, Dr. Kara from Cranberry Country Equine Veterinarian Service, and we're in her facility today, and we're going to ask her some questions on how she got started and how she's evolved and where she's going from here. So, okay, so where did you grow up, and what was your family life like as a child?
So I was actually born in Tomah, Wisconsin, grew up here in Warrens. I have two little sisters, mom, dad, was, so family. We grew up on a cranberry marsh. That's where the name came from. So my husband, my dad, both my parents, different sides of their families are all into raising cranberries. So it's kind of an important part of this area. I grew up in the country kid through and through.
So what were your interests then as a child besides the cranberries?
And horses.
And
When I was like 3 or 4 years old, I became horse crazy. But I also grew up in the country, so I was always outside playing. So all the wildlife, plants, fish. I grew up on a pond, went fishing all the time. Very much an outdoorsy nature child.
Yeah.
So
you were really hands-on and, getting out in nature and loving animals.
Yep.
And,
tracking deer trails through the woods and with my dog.
Yeah.
So, yeah.
So what really sparked your interest in, horses and, getting into the veterinarian business? And
so I actually have a lot of history that not everybody knows about too, because I might have been born and raised here and grew up here, but when I went to school, I kind of thought I was maybe going to go into the wildlife field. So I went out and lived in Idaho for 5 years, and I got a degree studying population genetics of parrots. So we were using feathers for a genetic source, and I actually got to go to Peru to collect feather samples.
Oh, wow.
And I thought I was going to be a professor and be a teacher someday. And then kind of once I got there, I decided that it was a really high stress field where I just didn't feel like it was going to serve me well long term. You're always writing grants and trying to come up with research projects and like new ideas, and you have to be at the the forefront of like the research field, and it was really stressful. And I saw like how my professors were, like what their lives were like, and I just didn't think I could handle it.
Yeah.
So after when I was a little kid, I always wanted to be a vet. When you're little, that's like everybody wants to be a vet. If you love animals, you're going to be a vet. But then as you get older, you kind of realize that there are other fields out there that you can have with animals.
Yeah.
And that was when I got into the wildlife research.
Yeah.
But then here I am, and I'm an adult. I now have, a master's degree and a bachelor's degree in a field that I was like, I don't know if I want to keep going this direction. And I decided at that point that it was time to kind of go back to my roots. And so then I applied to vet school, and I came back to Wisconsin, and I went to vet school in Madison here in Wisconsin. And I love it. It's perfect for me.
Yeah.
Like all the other stuff was interesting, and it kind of helped form who I am, but this, like being a veterinarian, is truly what I was meant to do. I know it for sure.
How many years did you have to go to school to be a veterinarian?
Well, you have to get a bachelor's degree, so that's 4 years after high school, and then it's a 4-year vet program. But I sort of did a little, side jog, and I also got another 2-year degree, a master's degree in there too. So a little bit extra schooling.
Yeah. Did you work for somebody after you graduated, or did you just start out on your own right away?
I actually got a job here in Tomah with another vet clinic, and I worked there for 4 years. Well, actually, I worked for 2 different vet clinics in the Tomah area, so kind of split time between the 2 clinics.
Mm-hmm.
And I did that for 4 years, but neither clinic, one was a small animal clinic, one was a cattle clinic, and neither of them were really focused on horses. And kind of as I became more and more into it, gained experience, I realized that that was really where I actually wanted to focus. That was where my strength was.
So that's
Especially
kind of
for our area.
when you decided to go off on your own then, or? Yeah.
Yep, so in 2018, I opened my own practice.
Okay. Yeah. Okay, we're gonna dive deep into what you do on a day-to-day basis as far as working with horses and diagnosing and treatments. The next question was metabolic laminitis and EMS, equine metabolic syndrome. How do you treat this and approach this on an aid and rehab?
So equine metabolic syndrome is the name for this issue where some horses are super easy keepers and they develop insulin resistance, obesity, and subsequently laminitis. That's probably the worst part, is they get laminitis in their feet and they founder and their feet hurt, they're crippled. The most important thing in managing this is to prevent it, number one.
Yeah.
Prevention is the best thing to do, and to do that we have to keep our horses a healthy weight and understand what nutrition they need, to keep their bodies healthy. There are some breeds that are more prone to equine metabolic syndrome or to developing equine metabolic syndrome, like ponies, Mustangs, some Arabians. I've seen a lot of Tennessee walking horses with it, Morgans. If you have one of those breeds, you really need to try hard to keep your horse a healthy weight. You don't want them to founder. Once they have damage in their feet, the damage is done, and it will be something that you fight with for the rest of their life. But so keeping them a healthy weight, how do you do that?
Yeah, that's that's what I see out in the field too.
Yeah.
Is, a lot of these horses, they don't get used, and they're standing around the hay feeder all day and not getting exercise, and it's a big problem. So
yeah.
Yeah.
So management
Yeah.
is the number one thing.
Yeah.
So controlled feed intake and exercise. Hardly ever see laminitic equine metabolic syndrome horses at the Amish because they get exercise. Like if you have one that's prone to that, that's the best place for him to be, is to be an Amish horse.
Yeah.
They'll be an easy keeper, a good healthy weight, and they'll never have sore feet.
Right. Yeah.
But yeah, and it's a struggle because a lot of people here want to, we think food equals happiness, so like if your horse is eating grass and happy, then that's happiness, that's healthiness, but it's not. I mean, if your feet hurt and you're in chronic pain, then that's not happiness.
You can kill your horse with kindness and love.
Yes, you can.
Yeah.
So, there's a lot more that we could go into discussing that, but the main thing is management. Find a way to lower your horse's intake of feed and get them the exercise they need. A lot of different ways to do that.
Right, yeah. As far as Cushing's disease, PPID, what is it, and how do you treat this and approach this problem? Because it seems like it's getting to be more prevalent.
It is. The main reason it's becoming more prevalent is because we have older horses. Like horses are living longer these days because we have better care, better dental care, better feeds that we can keep them going longer. So the older a horse gets, the more likely they are to develop Cushing's disease or PPID. It's pars pituitary intermedia dysfunction is what that means. That's why we call it PPID.
Yeah.
But all it is a little tumor in the pituitary gland of a horse, and it's a benign tumor, but almost all horses have this. It's just something about the equine group that they develop like an adenoma in this area, and in that pituitary gland, and it causes pressure on surrounding brain tissue, and so it causes hormone dysregulation. Some horses will develop will develop symptoms, but not all do. So.
Now, is this something that could be removed at some point, do you think?
It's the pituitary gland,
Yeah.
which is like deep in the base of the skull. Like it is
Okay.
not really accessible. So I doubt that would be something that they could do. I mean, if you think about it, like with human brain things, I mean, you could do like targeted radiation to try to do
Right.
stuff, but I think you would get so much. It's so complicated, the brain is, and like all the pathways and stuff that control the pituitary gland controls your daily rhythms, your circadian rhythms, and your hormones. And if you mess that up,
Right.
that's what Cushing's disease is. Basically, your hormones are in dysregulation.
Right. I mean, what do you think, personally is triggering this besides, our horses are living longer? Is there some like root cause you think that's causing this as far as, dietary or, lack of something or too much of something?
I honestly don't think so. I just think that it is just a predisposition to the equine species that they develop this adenoma in that part of their brain. Because I've been told that, like, if you were to look at the pituitary gland of all horses at 30 years old, you'd see some degree of this adenoma growth. It's just how big does it get and how much pressure does it put on surrounding tissues and cause dysfunction in those tissues. So it's really a complicated thing in the brain, but externally we're seeing things like long hair coat, they don't shed,
Yeah.
laminitis in their feet. They might develop some equine metabolic syndrome type attributes like fat deposits and stuff like that. But those are external symptoms that we see. This condition is usually present much sooner than when we see it.
Right.
And so our ability to recognize it is a lot better than it used to be. Plus we can test for it earlier.
Yeah.
So
What is your treatment plan, when you diagnose one with Cushing's?
it really depends on the goals.
Yeah.
So like that's a thing with medicine, and veterinary medicine is so much of it depends on the owner's goals and what the horse needs to be happy. So if it's a pasture pet and he's doing okay and his feet don't hurt, you don't have to do anything. You
Right.
could just clip him, make sure he doesn't, he's maybe control his diet, kind of cut out some of the starches and sugars in his diet, clip his hair, keep him comfortable. But if this is a horse that you're noticing muscle wasting, muscle loss, lethargy, but you're still riding him and he needs to be a performance horse, sometimes those horses benefit from medication too. If they develop laminitis in their feet or other things, like the hair coat is just too uncomfortable for them, sometimes just starting medication. There is a medication called pergolide that helps kind of restore some of that dysregulation in their brain, sort of kind of cuts down on some of the dysregulated hormones. But those medications, if you get it right, like the horse can be normal appearing for, control those symptoms for several years.
Yeah.
So,
a lot of people, when their horse gets diagnosed with Cushing's disease, it's, they think it's a death sentence. So there is some type of
definitely.
There's things out there that can help them, live a longer life. And
Yeah, I wouldn't say Cushing's disease is a death sentence unless they have developed laminitis because of it, which a lot of them do. Not all of them, but a lot of them. Most of the time the horses are fine.
Yeah.
They're okay, they're eating, drinking, but we also see some that get more lethargic and just kind of uninterested in life. And it's all a hormone thing. It's kind of very similar to, I think people, when you go through depression and other things, like externally you might be okay, but
Right.
internally maybe not.
Yeah.
So.
Yeah.
Yeah, so Lyme disease is really complicated, and we are noticing it more, but we do see it more too because of our habitat fragmentation and our increasing deer populations in the area. Like our deer populations are so high, and that is how this disease gets circulated to the ticks. So.
Right. Okay.
Yeah.
Well, thank you. So, talking about iron overload, it seems to be a problem with a lot of horses around here. There's a lot of iron in our water, and a lot of these mineral companies will load these minerals with iron. What do you see out in the field, with iron overload and with the problems with horses, and how do you address that to your customers?
So, we do have a lot of iron in our soil and in our water, but horses are actually pretty well adapted to deal with that. So we don't actually see a lot of iron toxicity or iron overload symptoms. The ones that you would see, usually like a poor hoof quality, bleachy hair coat. I mean, so there's definitely, it's not a super severe thing. There's some people that think that iron overload contributes to like insulin resistance, but there isn't actually any good research that backs that up, which we need more research to look into that and see if that is actually the case. But the main issue with iron, like in our area, it's mostly iron oxide, and that's not very well absorbed by the horse's body. It's extremely poorly absorbed. So it takes years and years and years of exposure to really build up a lot. Mostly the problem it causes with having a lot of iron in the water and in the soil and in their feeds is it changes how other minerals are absorbed. So like copper and zinc can be poorly absorbed, and those are very important for hoof and hair quality too. So it might not necessarily be the iron that we're seeing as much as like a deficiency in other minerals.
Right.
So I guess in our area, I don't worry as much about the iron as I do about the other minerals. Like I want to make sure that all the horses have an appropriate mineral. And no, we don't need iron in our minerals in this area.
No, not in this
And
area.
actually, honestly, probably not in any area.
Yeah.
So,
Well,
I mean,
is that true that horses, if they do have too much iron in their system, they can't secrete it like a human can, or is?
well, they don't. I mean, it's hard for them to absorb it.
Yeah.
Like it passes straight through their gut. So just like with humans too, though, it's hard for us to absorb iron too, like extremely hard. So in order to, women have to supplement with iron all the time, and to keep from being deficient, we usually have to take quite a high level. We don't get it from drinking iron water.
Right.
It doesn't work that way. So as far as how they excrete iron, I'd have to do a little more reading about that, but I mean, even with humans, if you have too much iron in your system, they don't wait for you to excrete it. They usually take blood, and that's how they remove iron from your body. They take blood and remove the iron in the hemoglobin. So, bloodletting.
Yeah.
But they don't see that very much. All of our health, ours and our horses, is their nutrition, what goes into their bodies. So I do think we, number one, need to make sure that horses are on a good vitamin mineral supplement. Like it actually needs to be one that has the right concentrations for the area that we live in, because every area is a little different.
Right.
And our area is low in selenium, so we need to make sure that we do have enough selenium in our minerals. So a lot of people like to use the mineral salt blocks, like the selenium and the trace mineral salt blocks. And when I first I lived in Idaho for 5 years, remember?
Yeah.
And my 3 horses that I got out there, when I brought them here, it took about a year, and my one mare started getting a crack in her hoof. And I was like, what is happening?
Yeah.
And like, I have these salt blocks. This is same thing I gave them out in Idaho. I've got these selenium salt blocks, like why is this happening? Like this horse has never had a crack before. It was right in the center, right up her dorsal hoof wall on both front feet. So I started, and I was in vet school at this time, and we'd had some nutrition lectures and stuff. And so I got really into it, and I ended up buying some textbooks called a textbook called the Nutrition Requirements for Horses.
The NRC.
Yes, they come out with that one every few years. They revamp their requirements, and it's all based on research, scientific research. So, so it's constantly evolving and changing as we learn more and more. And I went through that whole book, and I wrote down what my horses needed. I made a spreadsheet. I calculated what they were getting in these mineral blocks, and then I went on like Dairyland Labs, like feed. They actually post all of the like the nutrient content of like the average Wisconsin haze, like your alfalfa haze, your grass haze. Like they'll post their data, and I just took their information and added like the forage plus the minerals they were getting to see where they were deficient. Zinc was my number one deficiency.
Really? Huh.
Zinc. And so I switched at that point. I was like, well, okay, blocks are not the way to feed horses minerals. I mean, for some people, that's the easiest way to do it. So like, I don't totally poo-poo them. However, I do know that they're not good enough.
Yeah.
That was actually when I switched to Equishine.
Okay.
When using Equishine,
Yeah.
plus Purina and Rich. Like I love those two products together. I actually feed them both. And I mean, I haven't had cracks since then. That same mare, I still have her. She's 23 now. She doesn't have cracks anymore. It was just that first year. It was the weirdest thing. And also my one of my other mares used to have a very thick mane in Idaho, and then moved here and it wasn't so thick anymore. So it's really weird. So that just shows you like is the same feeds she was getting out there versus here. It was all what was in the forage that was different. So knowing what you have in your area that you live in, and like something that's made nationwide and has these very set guidelines is not necessarily the best for every area. So
right. Probably getting your hay tested is probably a key ingredient as far as supplementing.
So I do have a really strong interest in nutrition.
Well, thank you for that.
Yeah.
So the hoof is made up of 90% protein, specifically keratin cells. What other kind of supplements do you recommend or see deficiencies in the, specifically in the feet? And I think we kind of just covered that a little bit now. But
we did, but I mean, that's the thing is like, I don't feel like you want to pick one supplement for one part of the body, right? Because the whole body is connected, and the feet are just one part of the body. They're similar, but it's connected. Everything else is going to affect that body as far as health-wise is also going to affect the feet, hair coat, all these external things that we see. Immune system, that's really important. How their immune system works and fighting disease and things. So that just having a really good balanced mineral for your area, vitamin and mineral supplement is really important. I mean, specifically when we have hoof issues, we look at copper and zinc and biotin and methionine. Those are probably like the 4 things that we need to make sure that are adequate in their diet, in their supplement. I think that most horses are over supplemented. Like everybody wants to buy this great new product to fix their horse, but I think it should just be so much more simple than that.
Yeah, I 100% agree with you on that one. It can be way more simpler than what people play it out to be. Is there like a blood test that you can do to test for deficiencies
So you can do some testing with blood, but our bodies are super designed to keep your blood levels consistent and stable. So actually testing for vitamins and minerals in your blood is not the best way to do it. It's actually liver biopsy. Like testing like the stores of those minerals in your liver is the way to do it, which we don't do. I mean, it's kind of risky. You know, it's risky to do liver biopsy, but they do those in like feedlot animals and stuff a lot when they're trying to really tweak their nutrition and stuff. You know, they'll do biopsies. So there are ways to get a liver biopsy in a live animal, but you can test some things in blood. There's not a lot of things. Like your vitamin E and selenium levels, you can test in your blood because your body doesn't have a lot of stores in other organs.
So you probably wouldn't really recommend a blood test unless you're seeing a major problem.
Yeah, I mean, if you're trying to, there are some different places where you can send out for like some micronutrient testing and things like that. It's just, if you've got if you're getting deficiencies on these tests, you're probably deficient. But it can be really hard to get that because our body is designed to keep things really stable in our blood. Iron, like your blood levels and your iron, unless you're severely anemic, they're usually just kind of in this normal range. Like in humans, we test ferritin, which is kind of tells you what your long-term storage is, not like your day-to-day iron levels. But so you can. I guess I feel like it's not the best way to really. You know what? It does make me want to test all my horses and see what all of their levels are. I would do it. But
I mean, in the farrier industry, you know, it's like you can on the outer hoof wall, you can see, you know, you can read that outer hoof wall as it grows down. You know there were certain things that triggered, you know, disruptions in the growth or growth rings or, you know, little things that.
Yeah, you can see changes and stuff in it.
Right. So, but. You know,
but it doesn't always mean that you can test that particular spot on the hoof and tell what mineral was there at that very moment. I mean, it's just not reliable. That's the only thing. You can do it. It's just not super reliable. So, okay, so, you know, we're just talking about how so many things are affected by your basic nutrition. And a lot of horses are over-supplemented. I just wanted to point out a few of the things that I do think that we also need to keep in mind with our horses. So not only our vitamins and minerals and selenium, zinc, copper, there's a lot more than just those. But vitamin E is really important too, especially in horses that are fed hay year-round, because the vitamin E is only produced in fresh green forage. It's, you know, so grazing on grass, horses are getting vitamin E. Omega-3s are really important. And specifically, you know, a lot of our forages have omegas. I worry about the supplements out there. They'll you know, tout that, oh, this is an omega supplement, it's so great. But you have to look at the ratios of the omega-3s. You want to have high omega-3s, higher than your omega-6s and omega-9s. It's the ratio that's important, not just the fact that there are omegas and omega-3s in the supplement. Having more omega-3s actually helps our body be anti-inflammatory. So otherwise, if you have too many of the other, it's a little more pro-inflammatory. So like battling arthritis, allergies, stomach ulcers, things like that, omega-3s. Like, and these are proven. Like there's research that backs these up. Vitamin E, omega-3s, and then of course our selenium in our area for sure. So.
What kind of supplements can you use for the omega-3s?
So right now we have the Platinum Healthy Weight Oil. That's the one I really like. That's what we have. But in the past we've used Excel EQ, that one. So because people show me omega supplements all the time, so I'm like, let me see the label. You know, so like I'm reading all the fine print on the label, and so we'll switch to whichever one is the least expensive and has the best like omega-3 to omega-6 and 9 profile. So yeah, we used to have Excel EQ was a good one that we used. It's still good. It just that one was cheaper and had more omega-3s. I think Purina also makes an omega oil, but as far as a natural source flax seed, ground flax meal, fish oil.
Right.
not that horses like fish oil, but
Yeah.
you know, so there are some natural sources camelina oil, those are natural sources too. So.
Yeah.
What do you recommend for vitamin E supplement?
That one's a loaded question too. They're all loaded questions. I don't get as hung up on the like the synthetic and non-synthetic vitamin E. I do try to make sure that we just have overall, we're meeting like the basic requirements, and if our horse has an issue, a neurologic type of issue, that we're supplementing with enough vitamin E. So it can be quite a high amount. As far as what source of vitamin E, I'm not picky. Like, I think we have one from Equine. Doctor's Choice Supplements makes a vitamin E supplement that we use. Oh yeah, it's probably behind you there. But otherwise, vitamin E.
Right.
It's also like, it's super common. It's a preservative. We use it in a lot of different things.
Yeah.
And our bodies do still absorb that vitamin E, even if it's not, if it's synthetic. But so I'm not too picky about that one.
Well, thank you, Dr. Kara. So, one of the biggest, what do you see for some of the biggest issues out in the field right now as far as horse health when you're out there diagnosing? Is there some, really big issues right now?
Right now?
Yeah.
Well, I mean, everybody is probably talking about the EHV outbreak right now.
Yeah.
That one, I know we have another question about that one later on, but
Yeah.
like, as far as the biggest issues, that's really hard to pick out big issues, because all of these issues have to do with how we manage horses. I think that's probably the biggest issue we have, is our management of horses, and how our management is not always in line with like how horses evolved and adapted and what makes them happiest. So, we're gonna ride them, keep them in a warm barn because that's what makes us comfortable, but horses don't like that. Like, none of it. They want to be out there eating grass, grazing all day long, wandering, moving constantly. So I think most of our big issues can all be linked in how we manage horses.
Yeah.
I mean, there's equine metabolic syndrome, ulcers, gastric ulcers, laminitis, and of course some of the infectious diseases too, because we're taking horses from one place to another and, traveling long distances and exposing horses to each other that wouldn't otherwise ever have met each other. So that one's kind of complicated.
Yeah.
Which issue would you like to talk about?
Right. It just all comes down to management. And,
I think so.
Just letting a horse be a horse more than, thinking, oh, we can put him in this nice little box and make him nice and comfy and,
And wearing blankets.
Yeah.
I mean, like, what makes us feel comfortable is not always what the horses, what makes them feel comfortable.
Right.
So.
Yeah, I mean, 90% of the time, my horses are, they got a run in, they can go in, and most of the time they're outside in the wind and the rain, and they'd rather be out there than in the run in. So.
Yep. They're tough.
Yeah.
They're a lot tougher than we are.
Okay, thank you for that. Yeah. Okay, the next question. So we're going to kind of change the subject a little bit. We're going to get into teeth, and what do you look for in the teeth, and how often do you recommend that teeth get floated, or what kind of problems are you seeing out in the field?
So horses are very well evolved to wear their teeth constantly, eat forage, but you combine, the perfect horse mouth that's designed to eat feed, you can have some genetic problems, like malocclusions, where like horses, their teeth don't line up perfectly, or maybe they break a tooth or something like that. Like, there are definitely, you can have the perfect horses and the ones that have issues. So your perfect horse mouth might really only need to be looked at and evaluated every couple years. But you're not, if you don't look in there to evaluate and see, you're never going to know if that horse broke a tooth or did something like that. They're extremely good at hiding those things. Sometimes you might see them chew funny. Sometimes they lose weight, but you'd be surprised how bad it can be in their mouths before you see some external signs. It's crazy. Sometimes you have no idea, and you open their mouth, and it's like, whoa. I personally feel like horses should start having their mouth looked at I think 2 years old, or when they're full. When we look at them when they're full, we should make sure that they don't have an overbite or an underbite or something weird, because if they do, you should start doing some adjustments right away to try to help their mouth grow. Otherwise, they can start getting overgrowths that limit the growth of their mouth. So before a horse goes into training, I think they should have their teeth looked at.
They don't. Once even as a foal, their teeth are permanent, right? Or they don't have baby teeth, or
they do have baby teeth.
Oh,
so like on horse, like all of these incisors are baby teeth when they're born. Actually, they're born with only the first two. They only have 2 teeth in the front, just these 2. And then like by a couple months, they'll have the second 2. By about 8 to 9 months, they'll have this next one. So they erupt their baby teeth. Then they lose these at 2.5 years, 3.5, and 4.5 years old, and grow in an adult tooth.
Okay.
They also, the first 3 molars on their here have a baby tooth version, have a deciduous version. So then they lose these between 2 and 4 years old, and they'll become their permanent teeth. They have 6 molars total. This last one doesn't even erupt until they're like 4 years old.
Okay.
Yeah, 4 years old. So their mouth, their face, their mouths are growing until they're like 6, 7 years old. Like their skull is growing and adjusting. So I do think it's really important to check young horses' mouths, because if they do have major issues, you can actually get on top of them and fix them early on, as far as like impacted teeth, caps that are retained. Plus, if you're going to start training your horse and you're going to put a bit in the horse's mouth, you don't want it to be cutting itself on its teeth. Right. Having some sources of pain that really it doesn't need to have. I mean, just a routine exam and then take these sharp points off the edges is, it doesn't even have to be a long, in-depth exam for a 2-year-old, but I personally do all my own horses float their teeth when they're 2, and every year. Once they hit 5, 6, and all of their teeth are permanent, and you look and everything looks great, everything's in line, then, maybe they're fine for several years unless you notice a problem. But I probably wouldn't let them go more than like 2 to 3 years without really just looking, because once something starts to happen, if you let it go too long, it can be really difficult to correct.
Right. So there's been a lot of debate lately, on social media as far as when their teeth are wearing, there's all these, feeders they got out there now where they're way up in the air and they got to put their nose way up in there to grab the hay and chew on it. Do you think that is getting to be more of a problem as far as their teeth wearing? And
definitely. So you got to start with like what you have genetically, right? So let's say you have a horse with an overbite, okay? So like its top jaw juts out below the bottom jaw. Now, when the horse's head is up, that bottom jaw is going to be slid back because, just gravity-wise, when it puts its head straight down, that bottom jaw slides forward, just weight-wise. So a horse that has an overjet, you need to feed it off the ground. Otherwise, you're going to accentuate that malocclusion. So, but if you have a horse that has the opposite, maybe that one needs to eat up high, because we need to try to keep that jaw forced back a little more to try to, so that the teeth aren't wearing really abnormally. So there's no real it's going to be this way for all horses answer. But definitely, it's always something we should think about. How is this horse eating? What is it? How is it affecting how its teeth are wearing? Does it always pull its head the same direction when it pulls hay out? I don't know.
Right.
So definitely.
So yeah, I agree with you on that too. It's you know, some of these feeding styles, you know, and these feeders they have out there are kind of contradictory to the way the horses really are meant to eat, and you know.
Well, and you know, trying to solve one issue, we don't want to create another one.
Right.
So, you know, we're trying to solve the issue of we don't want to waste hay, and we want to limit how fast our horses eat so that they can eat longer, like what is more natural for them, you know, eat smaller amounts throughout the day. So we net things, and everybody is netting things now. And some horses do get some wear on their incisors from hay nets too. But I have not seen anything that's excessive wear that would damage the incisors. And I feel like the benefit to their overall health of keeping hay in their bellies, preventing like stomach ulcers, and keeping their weight healthier is more important. It's always a risk-benefit discussion.
Yeah. So, you know, checking their teeth right at a full, is there a fold, making sure they're, you know, everything looks good, and then, you know, just checking them every couple of years going forward is probably the key to, you know, a healthy horse and healthy teeth. So.
Yeah, don't ignore them.
Yeah. All right, thank you. So, okay. So the next question here, what is the biggest moment in your career? I mean, the biggest aha moment that you know, where you really, you know, you learned something very significant in your life or in your career?
Well, I did just say earlier that when I saw that my mare, after living here for a year in Wisconsin, was developing a crack in her hoof, and then it kind of sent me into this spiral, learning all about nutrition. That was pretty big, you know. And then to learn that I could change, that I could manage things, and that I could affect how, I don't know.
Yeah.
I don't have any one aha moment.
Right.
I have a lot of them.
Yeah. Well,
because
well, tell us about you know, something that maybe was really significant, you know, to somebody, you know, a customer's horse or.
Oh man. You know, we always remember the ones that ended badly.
Yeah.
You know, that's the hard part with like veterinary medicine is we have both, and we see the worst of the worst. You know, I get called out when they're sick, not just for routine stuff. You know, usually. I mean, we get called out for both, but you know, sometimes things are outside of our control. You know, there are definitely a lot of situations where all we can do is do our best, and still it's something else is in control, not us.
For sure.
You know, probably one of the biggest things that I've realized and that has let me, you know, being a vet can be stressful. You know, there's a lot of people putting demands on you and a lot of pressure that you put on your own self to like keep things healthy, safe, happy, make everybody happy. I just lost my train of thought.
Well, yeah, I can attest to that too. It's.
Well, yeah, everybody wants to blame you when something
right,
goes wrong.
Yeah. I mean, it's you know, it's not just an animal that you have for work now. It's people's. It's part of people's family. You know, it's
connected to their emotions.
Right, and they don't want to lose a family member. You know, and so when there's a problem, it's like their mom or their dad or their brother or their sister, you know, is got this issue, and they want it fixed, and you know, they want answers.
Right. Yes. And that's what I actually was going to say is that, like, when I get called into a situation, it's not, my biggest thing I've had to learn is it's not always my job to fix it. Okay? It's not always my job to fix it, and I have to be okay with that. It is my job to help the owner understand what's happening, because that's where I can make the biggest difference. I can't always fix the issue, but I can help you understand the issue, think about options, maybe try to understand how we got to this point, and maybe fix it.
Yeah.
but I can't always fix it. So.
Yeah.
But yeah, so I had to kind of let go of that, having the pressure to fix everything. So that was big.
Good approach to dealing with hard situations, for sure. So, the next question there, talking about, mares, and, lactating mares, hypocalcemia. Do you see a lot of this out in the field? Is this a problem? Or?
So hypocalcemia means low blood calcium. That is something that if you're a dairy farmer, you know what that means. That means the cow just calved. She's now producing a ton of milk, and that milk is sucking the calcium out of her blood. And she doesn't have enough in her blood to function. And sometimes they're down. They can actually die from hypocalcemia, from acute low blood calcium. We don't really see that in horses.
Okay.
They don't have that real strong pull into their mammary tissue like a cow does. Because horses are designed to, their foals are the same as they are, where they're designed to eat all day long, small amounts. Whereas like a cow hides her calf over in the bush and she'll feed it twice a day.
Right.
She develops this big cistern and it's, they're different. Mares do produce quite a bit of milk, but we rarely see them have hypocalcemia. I'd have to say I don't think I've ever seen a mare that has had low blood calcium from foaling. However, low blood calcium and low calcium in general can be an issue with horses that are eating certain types of forage, which thankfully we don't have in this area. So there are types of forages that are really high in oxalates. Mostly those are like in tropical areas. Like the tropical plants are really high in oxalates, and that inhibits absorption of calcium in your gut.
Okay.
So the tropical horses, it's a real challenge to keep enough calcium in their system. Like in our area, horses get plenty of calcium. It's in alfalfa, grass. When a horse pees and you see that it's all cloudy and white, that's excess calcium being excreted in their urine. We have plenty of calcium. And that's actually getting into their bloodstream, and they're excreting it in their urine because they didn't need it.
Okay.
Horses in tropical areas that are eating these forages high in oxalates, they cannot absorb the calcium out of their gut. Like the oxalates bind to it and keep it from getting absorbed. So those horses definitely can develop low calcium. And what's bad about it is it's actually the calcium phosphorus ratio that's important. And we don't see issues in this area with that as much anymore because our nutrition and our understanding in horses is pretty solid. Your calcium phosphorus ratio needs to be 2 to 1. Calcium to phosphorus needs to be about 2 to 1, or at least 2 to 1. And you're always going to have that. If a horse is on forages, you'll never have to worry about that. If you're feeding them a ton of grain, you do need to worry about that. However, all of your grains that you buy are going to be enriched with calcium or something to make sure that ratio is correct, because your grains have a lot higher phosphorus. So back to these tropical places with these oxalates, now you're going to have a phosphorus ratio that's higher than your calcium ratio in your blood, and that causes, it's called secondary nutritional hyperparathyroidism. Like their parathyroid gland in their body, it's trying to keep their blood calcium levels high, and so it pulls all this calcium out of their bones. Their bones do not form correctly. They actually get really thickened and kind of weak and soft. In some of these tropical areas, it's called big head in horses, if you want to Google that. It's kind of interesting. But it's fixed just by supplementing with appropriate calcium phosphorus ratios. Getting rid of the oxalates in their feed.
Like areas like Florida, you think that would be like a problem there?
Some of the coastal areas, like horses that are eating marsh grasses. No, reed canary grass doesn't have a lot of oxalates and it has alkaloids, but probably some of the more tropical areas, but it'd have to be probably the more native, like marsh grasses and stuff, not what they're growing down in those areas, because any of the timothy and all those things they're going to be the same no matter where you are. Horses are very good excretors of calcium in their urine. So it's not really going to be an issue for them unless they are and we don't really understand why this happens, but some horses do develop urinary stones. Or even like stones in their GI tract, which is in both cases are caused by like deposition of minerals around like something and makes a little stone, and it just keeps growing. If we have a horse that makes stones, we actually try to reduce some of those minerals in their system. Make sure that they're drinking a lot of water and have more dilute urine so that they're not going to get like the crystallizing of the minerals in there. But most horses just have real thick, sludgy, yellow, white
I've
urine.
seen that before. Yeah,
It's calcium.
Yeah.
But we rarely ever see issues. It does happen sometimes, though. And I think most of the time it's some kind of a genetic predisposition of the horse to how they, because I also see horses that will secrete a lot of minerals in their saliva and they'll get tartar on their teeth. But they don't all do it. You can have same horses in a pasture eating the same thing, and only one of them gets like the tartar on like their canine teeth, like big balls of tartar. It's minerals in their saliva. And so every horse is a little different in their mineral complex of how their body excretes minerals in their saliva, their urine, and that sort of thing. So everything's individual.
What does it mean when they got that really dark urine then?
Like what color?
Like, almost like a brown, like a reddish tint brown to
Okay,
it.
so that is a health issue.
Okay.
That is bad.
Yeah.
So, dark yellow, like orangey yellow, that's not usually a problem. That just might indicate dehydration, where the urine's really concentrated. But once you start getting the red to brownish tinge, you're usually getting either you're getting some kind of myoglobin or hemoglobin that is getting excreted through their kidneys and coming out in their urine. So it's something from their body, either their muscles or their blood, that is getting broken down and passing through their kidneys out their urine. That's what that color is. So it's usually myoglobin or hemoglobin. Most of the horses that we see, it's myoglobin. So they're horses that tied up. They have a muscle, the muscles are stiff and sore, and they have, usually it's a genetic issue where they just aren't processing their muscle energy correctly. It causes stiff muscles, it damages their muscle cells break down, the myoglobin gets into their bloodstream, and then their kidneys filter it out. And myoglobin is actually pretty toxic to your kidneys because it has iron and it carries oxygen, and it is toxic to your kidney cells. So if it gets too dark brown, you can actually cause kidney failure. So horses that tie up, we are out there diluting their blood and their urine as much as possible to try to prevent toxicity in their kidneys. So tying up is usually a pretty acute issue. They need IV fluids or they need to drink a ton of water. So we usually have them give salt, like lots of salt by mouth, keep the horse drinking, get their urine more dilute to prevent kidney damage. So
well, that's good to know. I've actually seen that out in the field, where it's dark like that. So
well, sometimes, so especially like in the winter in the snow, if you ever see like reddish orange urine in the snow, that's actually just bacteria in the snow that turns it that color. If you see it come out of the horse brown, you need to freak out. If you see it on the ground and it's brown or red, then I would follow my horse around and watch them pee. Make sure that it's still yellow when it comes out. Because especially in the snow, it can turn colors. It's bacteria that turns it colors. So.
Okay, well, thank you, Dr. Kara. So the next question I have, as far as the GI, the gut, ulcers, do you see a lot of this, and especially with performance horses? And what is the treatment plan usually for dealing with ulcers and stuff like that? So.
Yeah, stomach ulcers, gastric ulcers, and hindgut ulcers. Like there's two different issues. I mean, it's becoming more and more recognized. I think we are understanding what causes it, plus like the ability to diagnose them with like gastroscopes and stuff is becoming more commonplace and more affordable. So we do see it a lot. We have a gastroscope here, and we can look for stomach ulcers if we have suspicions. I've seen I've seen a lot of horses where, you know, concerned about like cinchiness or kicking, poor performance. So we look for stomach ulcers, and I've seen a range from like just a couple little tiny ones till their whole stomach has sores everywhere, and it's amazing that they are even able to function. So it is definitely an issue.
Is that hard to treat then, when it gets that bad, or?
I'm gonna say not hard to treat, hard to make it stay away,
Right.
because once we can treat them, you know, we can give them medications, you know, change how they're eating. You know, they should have feed in their stomach all the time. Go for like alfalfa type forages that have more calcium and buffer their stomach acid more. And then we can use like stomach coating agents, sucralfate, omega-3s to prevent inflammation in their stomach, and then the medications that lower stomach acid. We can get them to heal up. The problem is, how do you keep it away? So there's something in that horse's lifestyle and or genetics that is causing this issue. So, you know, if we're not willing to change their lifestyle, they're probably going to get ulcers again.
Right.
And most of the time we can't always change their lifestyle. It's just what we do with our horses. You know, we're traveling, we're barrel racing, we're doing something that we're not willing to give up. We just want to find a way to help our horse be comfortable through that.
Right.
So
management would probably be the key to, you know, prevention as far as, you know, minimizing your horse's stress. And,
yeah, maybe take a buddy with them, or yeah.
As far as, you know, the supplements, do you think that, you know, especially with your performance horses and, you know, preventing ulcers, is it just something that they should just permanently be on, like a heavy dose of omega-3s, or?
I think so.
Yeah.
Plus it's going to help their joints
Yeah.
too, you know. So omega-3s, make sure vitamin E is really helpful for muscle recovery, stress. There are some other things that you can add for a real stressy horse, but they need to eat all the time, always have something in their stomach. You know, we now recognize that a horse should run on a full stomach, which is not what we do with people, right?
Yeah.
Like, people shouldn't have a full stomach before they exercise. So I think we didn't really think about that, but now we know that that is important for horses to have a full stomach. It lowers their risk of ulcers.
That's interesting, because it just seems like, you know, in the barrel horse, you know, in the racing industry, it's like, oh, they want them on an empty stomach. You know, they think they'll run faster, or, you know, you hear that a lot. You know?
Yep. Yeah, but it's also going to make the stomach acid splash,
Right,
and, you know,
right, yeah.
cause stomach ulcers, and
Right.
So.
Well, thank you for that. So the next question I have here for you is, so there are some drugs offered out there now that will help increase blood circulation during laminitis. Do you use them, and do you think it, you know, helps in the recovery?
So I haven't used those medications, partly because, you know, looking into them and doing reading with research, there isn't really strong evidence that suggests that it actually makes a difference. So that, combined with the cost of the medications, I've just never felt the need to go there. And we do have other mechanical ways we can help the horse, kind of similar to the shoe that we put on recently with the horse that had acute laminitis. I feel like in an acute laminitis situation, I think controlling pain and trying to get the mechanical changes in the foot to get them through that first period is important.
Yeah.
I would choose those 100 times over trying some medication that might improve blood flow in the feet, because I think we can improve the blood flow in the feet through mechanical changes, just changing their angles and trying to get the blood to flow the best around the whole foot. So and there's ways that we can evaluate that too. I haven't done a venogram yet, but I'd really like to do one someday. They're really fascinating to look at. So no,
I agree with you on that. I think you know, the mechanical approach is definitely, you know, it seems like it'd be just as effective and not so, you know, invasive to, you know, the horse as far as, you know, pumping a bunch of, you know, medications into them, or, you know.
Well, in their whole body, usually in an acute laminitis episode, there's something set it off, and their whole body is kind of in a stress state. So, you know, whether it's a chronic acute laminitis, like, you know, an equine metabolic syndrome horse, or a horse that just suddenly had some issue, like a high fever, or got into grain, or steroids, or something like that that set it off.
Sometimes there's a simple fix to a problem. You know,
Yeah.
if they got into the grain bin, you know, it's just a matter of, you know, restricting the grain.
Well, now that's a loaded thing too, because if a horse eats, like, you know, a half a bag of grain, and what happens with those cases is, like, that's too much grain for their body to digest. So that grain gets into their hindgut, and the hindgut should never have grain in it. It's always forage. The grain usually gets digested in their stomach. So their hindgut fermentation produces all these, like, toxins and bacteria that their body was never meant to deal with. So you can have a horse that will get hindgut acidosis and bloat and colic, and if it makes it through that colic, about 2 weeks later they can founder because of the toxins that were in their system then that affected the blood flow and the circulation in their feet. Toxins, you know, that affected those things. So, like, it's not always simple.
Right.
I guess
Right.
is that what I'm trying to say is that's, yeah, you don't want them to get into the grain in the first place. But once they've done it, what are you going to do?
Right, yeah.
Yeah.
So
it's tricky.
Yeah, so it, just kind of, I guess the biggest takeaway I got from that is just, you know, try to mechanically fix the problem before you start, you know, looking at other options. So.
Yeah, and I mean, I'm not saying don't give them any medications. I do think pain relief is really important for laminitis horses. And we do have a lot of pain relief options. Bute is the one everybody knows about, but you can also give them Tylenol and gabapentin. So there are a lot more pain relief options that we can do if just Bute is not cutting it. So if that horse is laying down all the time, or if it's just painful to watch, and if they're not going to get past that, then we need to also consider the ultimate pain relief of euthanasia.
Right.
So.
Yeah. So, all right. Thank you for that. So we got another really good loaded question here. What are your thoughts on the recent EHV1 virus, and, you know, have you seen that in our area at all, or?
So I feel like a lot of people don't realize that we had the neurologic EHV1 strain here in Wisconsin 2 winters ago. It was here. This time it's hasn't really come here yet, hasn't this strain that's been going around the performance horse industry. So we have EHV1. It causes upper respiratory disease, snotty nose, coughs. Once horses are infected, they're going to have it for the rest of their life. But there is a strain that likes the neurologic system and can cause neurologic signs. And I personally hadn't seen that strain here until, you know, that 2 winters ago. But it's here. Now it's here for sure. Even if it might have been here before, but I do know that the horses that brought the strain here before came from Pennsylvania. So through a sale, like in Thorpe probably, and then kind of distribute it among the community down in this area. That one, people didn't freak out about it because it was primarily in the Amish horses. It wasn't in the competition horses. But it could easily cross over. So, I mean, it's here. My note that I wrote down when I read that question was EHV is here to stay. So it's something we always need to keep in the back of our mind when we're mingling horses, you know.
So how does it spread then? Is it through horse to horse, or is it like...
Mostly horse to horse, but it can also be spread through fomites. So like somebody pets a horse on the nose here, you turn around, pet this horse on the nose. Tools, like, I mean, I don't want to pick on farriers, but you know, think about it. Let's say you're trimming a horse with a snotty nose, and he's rubbing his nose on your back, right? And then you go to the next place, and you don't think about that snot that's on your back. You could eat. I have had horses that have never been off their place get strangles, and I'm pretty sure that's how they got strangles. So that can happen too. So people can spread it. Sharing water buckets. Horses in the Amish community, you know, every Sunday they go to the next neighbor's house, and all the horses go in the barn, and they all drink out of the same water trough before they leave. You know, they're spreading it. It's just like when we go to Walmart, you're touching things, you're getting exposed to people. It's the same as the cold virus. So it's common, very contagious, and it's always going to be something that we have to think about. And the difference with the equine herpes virus is once they get it, they will have it forever. It will always be in their body. They will get over it, but when they're stressed, they may shed that virus and infect other horses. So it is a herpes virus, so that's how it works. So it's never going to go away.
It's kind of like shingles in humans when they get stressed. Once they have it, you know, if you get stressed, then it shows up again. Okay, well, thank you for that. Good. That was a very good discussion on that EHV one. So, but the next question I have here, as far as parasites and deworming, you know, what kind of programs do you suggest or recommend as far as the treatment plans and, you know, management, you know, with the horses?
So you probably know that you've heard of parasite resistance to dewormers. And we're seeing that more and more because we have a limited number of dewormers that we use. You know, and we went from probably not deworming very much to deworming a lot because parasites freak us out, to now we're kind of like, well, you know what, maybe we don't need to deworm quite that much because our dewormers are becoming less effective against these parasites. So at this point in time, like for the most part, like the recommendation used to be like deworm every couple months. We don't recommend that anymore. Twice a year is probably plenty for most horses. Adult horses, your foals are always going to be different. They're not as immune to the parasites as like from, you know, birth through 3 years old. Those horses should be dewormed more often, not just twice a year. And I would say even without necessarily doing fecal egg counts. But your horses that are, you know, in the prime of their life, fecal egg counts can kind of help us determine what their parasite burden is. And if we don't detect any eggs in their poop, then they don't have any adult worms that are shedding eggs at that point in time. Doesn't need to be dewormed. We're never going to get rid of all of the parasites, you know, with deworming, and that's not the goal. It's just to kind of keep the parasites at a manageable level to prevent disease in the horse. But the horses are actually pretty well adapted to having parasites. It's just, it's normal. It's the foals that I worry the most about.
Is it true that, you know, it's good to have some, you know, parasites running through their guts? And
I mean, I would say if you don't have any, then your immune system doesn't have anything to worry about, right? So you're not going to build up immunity. You know, so foals do need to be exposed to parasites to build up immunity so that by the time they're older, they can have some immunity. However, I do see, you know, we have a lot of Amish horses that don't deworm regularly or use alternative dewormers, and I see a lot of weanling to yearling age young horses that haven't been properly dewormed that end up they colic. They have such heavy parasite loads that when they do get dewormed, they get impactions. I've also had I've seen some that have had oh, I'll never forget this one. Like the foal was colicky and sick and started running a fever.
Yeah.
And I saw him a couple times in a week. And I'm like, I just couldn't quite figure out, like I could actually ultrasounded his abdomen and I could see something was weird in there.
Yeah.
But I couldn't tell exactly what it was. And then he ended up dying.
Oh my gosh.
So I cut open his gut and
Yeah.
the whole end of his cecum was black. And he had all of these little parasite migration like lines all over all of his guts, and like all these little blood clots everywhere from all the damage. And
Wow.
basically had so much parasite damage in his gut that part of it became necrotic because it cut the blood supply off.
Wow.
So, and that horse had natural whey minerals or mineral dewormer. Just FYI, doesn't work. So yeah, so a lot of these natural dewormers, they just don't work.
Yeah.
So, yeah, and it's so sad to see these foals with all these parasites that and they're colicky. So, the foals.
Yeah.
Let's deworm them every, couple months to keep their parasite burden lower,
Yeah.
like so that they don't get the scar tissue and the damage in their gut. But as adults, they're usually pretty resistant.
Yeah.
So
Okay. Well, I guess the key takeaway there is being very diligent with deworming your foals,
Yes.
your youngsters, and then twice a year for
Yeah.
Your older horses.
and or let's do some fecals and see
Right.
what their parasite burden actually is. If you have 10 horses out on pasture, usually only a couple of those are going to be the ones that are shedding the most eggs and contaminating the most of the pasture. So you really want to focus on those. Let's say you've got 2 high shedders in that group. So that's the point of doing if you wanted to do a herd-wise fecal egg count, you can't do just once. You got to do them a couple times because throughout the year things change, as far as how the parasites are with their biology and stuff with the horses. So you have to do a couple fecal egg counts. But if you have 2 that are shedding most of the eggs and you can concentrate on those 2 horses and deworm them, that's going to decrease the amount of eggs on pasture.
Sure.
So that the other horses won't be picking up as many parasites.
Yeah.
If you don't deworm the other horses, their immune systems are stronger and they're kind of keeping those parasites under control. That means that anything that they have in their gut has not been exposed to dewormer. So when they are reinfecting the pasture or whatever, it's naive parasites that are gonna be susceptible to dewormers. So then when these high shedders are picking up parasites, we're trying to keep the parasites sensitive to the dewormers by only getting rid of, by only treating the horses that really need the help.
So
Does that make
actually
sense?
testing would be very beneficial then.
Yes.
Interesting.
Yeah.
So I think there's a lot of horse owners out there that don't. I didn't even know that that there's certain horses that carry more than other horses, and by testing it can definitely make a difference as far as management. Especially when you got a large herd of horses together. So.
Yeah, and the only unfortunate thing, and I feel like the reason that we don't do more parasite testing for horses is that our dewormers are so inexpensive that it costs more to do fecal egg counts than it does just to go buy ivermectin from the store and deworm them. Although ivermectin's getting more expensive.
Yeah.
So,
Yeah.
but yeah.
All right, well, thank you for that. So, okay, so we got one last question here for you, Dr. Kara. So, what does it mean for you to be a veterinarian, and how has it really changed your life? How has it impacted your life as far as a career? And
Yeah, well, first of all, I know that this is what I was meant to be. It just fits me. I feel like every day is different for me. I go out and I like animals. I see them, I understand them, I know animal behavior, So when I go see an animal or somebody calls me out and they're trying to sort something out with a horse, whether it be they're sick or there's something, maybe they're lame, something's not right. I'm like a detective. I have to ask all the right questions to sort out what is wrong with this horse that can't tell me what's wrong. I have to go off of what the horse is showing me and what the client's telling me, which sometimes their impressions of what's happening in their horse are not always the same as what I see. So, you know, it's like detective work.
Yeah.
And it requires a lot of critical thinking,
Yeah.
and pulling together these different clues to come up with a story that makes sense, and then, you know, to explain what's going on. I always like to know how things happen and why I have to explain things.
Yeah.
And then, you know, use that to come up with the right path, or, you know, to decide what to do. So
it makes your job interesting. Then
it's
It's
interesting.
not like the mundane, everyday, same thing over and over again.
It's
you know?
different every day.
Yeah.
Yep. So
Yeah. Well, it's you know, is there anything that really stands out as far as, you know, this is why, you know, I chose this, you know, is it just for the love of the horse, or, you know?
well, the reason I went into the field, I feel like, well, you know, there's less and less veterinarians nowadays,
yeah.
especially large animal vets,
Yeah.
horse vets. And I think that it's really unfortunate that some of the challenges that, like, our older colleagues have had, that they are basically trying to dissuade some of the younger generations from pursuing these, you know, this path. It's not an easy path, and it's hard to really understand what, like, before I actually became a vet, you know, you think you know what it means to be a vet and what the life is like, but you don't really know until you're, like, in the middle of it, and you're the one that's listening to your phone.
Yeah.
And I used to get like heart palpitations, stress every time my phone would ring from being on call. So now I just turn my ringer off. So I just look at it often, but it doesn't give me the same stress.
Yeah.
So so some of that's really hard to understand until you're actually in the middle of it.
Yeah.
But I went into it thinking that, you know, I like animals, like we all do.
Yeah.
Not really understanding all of the stresses surrounding the job, but I don't know, it fits me, so.
Yeah. Well, I mean, is there anything that any message you could convey out there to some of these younger viewers, especially somebody that's thinking about getting into this profession, that would really stand out?
Well, I would say spend a lot of time with a large animal vet.
Yeah.
Like, you need to understand what their life is like, so that you know what you're getting into, because I think within the first 5 years of practice after graduating school, it's like 50% of vets leave. That's a lot.
That is, yeah, that's a high percentage.
So, you know, why would you go through all of that expense, you know, pay for school? It's hard work, and then to be so dissatisfied with it and quit. Like, I know a lot of people do spend a lot of time with vets, but, you know, before they even go to school, but you should spend time with a vet, and one that's actually likes their job, because maybe they can help you be enthusiastic about it, but also you have to really self-search to see if that's going to fit you too.
Yeah,
we're all different, so.
Yeah, that's a good point. Yeah.
On call is hard. It's hard to be on call all the time.
Yeah. So, well, Dr. Kara, I appreciate the time that we've, you know, you taking the time to come here, or to do this interview with me and be on the show. It's been very interesting, and you've had a lot of good, you know, takes on some of these questions here. So I really appreciate that. I appreciate your time, and I thank you. So.
Cool. Well, thank you.
Yeah, you're welcome.
It's good to work with you.
Yeah, you too. Yeah.